Hello, my name is Foukkare and I'm a student studying psychological science at the University of New England Armidale in Australia. I want to begin this video by congratulating you on your journey to overcome a phobia you have that's led you to my video. So I want to congratulate you. Well done for going on this journey, and well done, good on you, well done. I want to begin this video by stating that I'm not a trained therapist or counselor or psychologist. I'm an undergraduate psychology student studying. So this is information to be used for you as a resource, to look for further information. But I just wanted to let you know that from the start, I'm not a trained therapist, okay? Okay, I know your time's precious, so let's get into it. All right. So for you to be here, you must have developed a phobia of dog along the way. You could have been bitten by a dog or had a very traumatizing experience that's created this phobia. So we understand it's a real fear that you have, and you're trying to work through it. So that's wonderful. Now, what I'm going to discuss with you today in this video is a process called in vivo desensitization, and a much simpler way to refer to it, which is used in therapy, is called gradual exposure therapy. Now, what that means is that gradual exposure therapy, as the name implies, you're gradually exposed to a thing you have the fear of. In your case, it's a fear of dogs, okay? So, for simplicity's sake, in this video, I'll refer to all professionals, be it counselors or therapists or psychologists, as facilitators, just for ease of reference. Okay, so to begin with, before you begin your first session, the facilitator will do an interview with you to try and work out what are the things that trigger you. If you see a dog and you're fearful of them, what they call in psychology an antecedent. And this is what things that you're fearful of, that if you see a dog, it creates the anxiety or fear in you, okay? And the idea of the interview is that after you do the interview, the facilitator will do what's called a behavioral assessment, and that's to develop baseline measurements so that once you do the therapy, they can measure your success from the starting point, okay? Now, in this gradual exposure therapy, to help you with this, they develop what's called a subjective units of distress scale, and that creates a fear hierarchy. Now, what you're saying, what's a fear hierarchy, Steve? Okay, so the fear hierarchy are the things that you fear from the least fear up to the highest fear. And if the least fear is a scale of 0, and up to 100 is the maximum fear, okay? Now, you can have from 10 levels up to 20 levels of the fear hierarchy. Just depends on how many you identify, how many things you have a fear of. But there's no exact number you need, but normally at least minimum of 10, okay? Now, with this gradual exposure therapy, it can be done either as one long session of 3 hours, which some therapists do, or others, depending on your availability, can do multiple sessions of 1 hour or longer, but both scenarios can have good results. So it's important for you to know both scenarios will work depending on what works for you, okay? So the way gradual exposure therapy works, you in the first session, you'll be exposed to the thing that you have the least fear of. With a dog, it might be, it could be seeing a photo of a dog or being a certain distance, say 10, 20 minutes from a dog. That could be the least fear. And it could go right up to the highest fear you have, which could be a dog being next to you, or you patting a dog, or if you were to, for example, feed a dog, to maybe create a different association that dogs' mouths can be calm rather than biting you in fear, okay? But you'll work out with your facilitator your own fear hierarchy. Those were just a few examples I gave you, all right? Now, during the sessions, the facilitator, while you're going up these levels, will give you what's called positive reinforcement. So they'll say things to you like, "Well done, Steve, congratulations, doing really well." They'll also give you something called non-verbal. So that includes smiling at you and nodding at you, just to give you that reassurance that you're doing really well, okay? And then during the sessions, the facilitator will be there most of the time, but then they'll slowly step back a bit away from your exposure, so that it creates a bit more of a real life scenario for you to be with a dog by yourself. They'll still be there in the background, just step away a little bit to make it more realistic for you, which helps you with overcoming the phobia. Now, during the sessions and after the sessions, the facilitator will help you with something called adherence procedures and strategies, and they are to help you on your journey. So they'll help you with something called self-monitoring, where you take ownership of your progress and and the work you're going to do at home while you're doing these sessions. Now, with this self-monitoring, something linked to that is goal setting. Goal setting is very important. So, and as long as the goals are achievable. So in your case, it might be a matter of doing some homework every 2 days in between sessions. Okay, but you'll work out what works with the facilitator, what works for you. Journaling has been found to be a very good way to reflect and write down your feelings, how you're feeling after sessions. If you have an encounter with a dog, how it made you feel. So journaling is a really good way to do that. And also by documenting it, you can then go through it with your facilitator during the sessions, and you can get some feedback from the facilitator. Another really good thing to help you is social support. So either you could get your family member, friend, partner, husband, anybody that's close to you. They can give you some social support and help you on this journey. So having a friend who you can confide in and talk to is really important. And that social support can also help with positive reinforcement. They can give you positive reinforcement outside of the sessions, which is really helpful. Another thing that you can do is called self-instruction and self-praise. So you can learn how that if you're near a dog, to tell yourself, Steve, you're safe, the dog's not going to hurt you, and you can learn to understand that. And when you do well, give yourself that pat on the back and say, well done, Steve, you did well then, you stayed calm. So those are really good strategies to help you out. Now, during the sessions, I want you to be patient with yourself. Don't expect to get to your highest level within the sessions or straight away. Be proud of the progress you're making, okay? And be proud of the achievements you're making along the way. You might need to take baby steps. There's no perfect timeline. There's no timeline to stick to. You do what works for you. But as long as you're making progress and be proud of yourself along the way is very important, okay? Now, once the session's finished, another really good idea is to have a reflective and discussion, a debrief with the facilitator to see how it all went, the challenges you had, what really worked, and that way you can understand how you're going along your journey, okay? Also, a really good thing to catch up is maybe about 4 to 6 weeks after the sessions finish. Have a catch up with the facilitator, see how you're going, see how you're working on your phobia. Hopefully you've overcome it, but if you're on your journey, the facilitator can maybe help you with some more ways to work on that. Okay, now I want to leave you with some resources to help you out. The one resource I want to help you with is a really good, if you want to see a real life model of how gradual exposure therapy works. If you go to YouTube and type in Dr. Ost, that's OST, and type in these words, snake phobia behavioral exposure therapy, you'll see a 12-minute video of Dr. Ost doing a real life gradual exposure on a lady who had a very bad fear of snakes. In a 3-hour session, by the end of the 3 hours, the lady overcome her fear and even had a snake over her neck and was very comfortable. It's amazing to see the transformation. Seeing this lady overcome her phobia is a really good way for you to see a model of how good gradual exposure therapy can be to overcome a phobia. So I highly recommend you watching that video. It's wonderful. Look, once again, I want to congratulate you on this journey you're on to overcome your phobia. I wish you best wishes on going through it and working on this process. And I'm sure you're going to do it, and good luck. And thanks for listening. All the best. Bye-bye for now.